Hi, I'm Sana Habib. I'm doing my presentation on substance use. I'm a first-year pediatric resident. So I just want to go through and talk about the objectives of my presentation. First, I want to talk about definitions of substance abuse, tolerance, and other categories regarding to substance use. I also want to go through some statistics in adolescents regarding substance use and guidelines and screening that we can use. And I also want to talk about a few examples of common drugs that are abused. The list is very long of the drugs that are used, but these are the ones that I found very interesting. So definitions. So risky use is defined as consumption that increases the chance of health consequences. For example, injuries or medical problems or interpersonal problems in relationships. Physical dependence is a state where a person will develop withdrawal symptoms after abrupt cessation or by tolerance to the substance. And tolerance is defined by basically someone will need to take higher doses of the drug to achieve the same effect or level of response that they initially did when they first started taking this drug. And addiction is defined as impaired control over substance use, compulsive use, and continued use despite harm and cravings. So substance use disorder, as defined by DSM-5, there's a certain criteria, a minimum of 2 to 3 criteria is required out of this list of 11. I didn't include the list, but the list is comprised of things like a person who will have increased cravings, or a person where the substance use will interfere with their life, or they are having a lot of time dedicated to finding these substances. And in the new DSM-5 criteria, the substance use disorder is specified. It's not just substance use disorder, it'll be like opioid use disorder or cocaine use disorder. And by the substance use disorder is categorized by mild, moderate, severe, based on how many criteria in the list of 11. So here's some statistics that I found on U.S. Department of Health and Human Services. So I found statistics basically looking at New Mexico versus the United States average. And most of the statistics are equal, if not above, the United States average. So, for example, the percent of high school students who reported they smoked cigarettes on at least one day during the 30 days before the survey, New Mexico's average was 11%, and the United States average was 11%, so they're equivalent. The percent of high school students who report they drank alcohol for the first time before age 13, New Mexico's average was higher than United States percent at 20%. And the percent of high school students who reported they had ever used marijuana, the average for the United States was 7%. The New Mexico data was not out yet. And the percent of high school students who reported they had ever sniffed glue, breathed the contents of aerosol spray cans, or inhaled any paints or sprays to get high one or more times. So basically this is looking at the use of inhalants, and the United States average is 7%. The percent of adolescents aged 12 to 17 who report they used pain relievers for non-medical reasons, the New Mexico and United States average was 55%. And the percent of high school students who report that they used any form of cocaine in powder, crack, or freebase one or more times in their life, New Mexico was 9%, which is 4% higher than United States at 5%. So guidelines. According to AAP and Bright Futures, you want to begin screening for substance use at 11 years old. You want to ask patients about alcohol, tobacco, smokeless tobacco, illicit drugs. You don't want to forget to ask about anabolic steroids and inhalants, which is often overlooked. There's a craft screen, which I'll be talking about in a little bit. And you also want to ask friends about their friends because patients are more likely to disclose about their friends rather than themselves. And who you hang out with in your peer group really affects what you do. So the craft criteria. So there's two parts. In part A, you ask 3 questions, and if the patient answers yes to any of them, then they have to answer the 6 questions of part B. And if they answer no to all of them, they'll just have to answer the first question of part B. So in part A, you want to look at, you'll ask, in the past 12 months, has the patient drank any alcohol, smoked any marijuana, used anything else to get high? And then part B, these 6 questions talk about, have you ever ridden in a car driven by someone, including yourself, who is high? It looks at, do you ever use alcohol or drugs to relax, feel better about yourself, or fit in? Do you ever use alcohol, drugs while you're by yourself or basically alone? Do you ever forget things you did while using alcohol or drugs? Do your family or friends ever tell you that you should cut down on your drinking or drug use? Have you gotten into trouble while you were using alcohol or drugs? So this is a great questionnaire to screen patients when they come in for visits. Their well child check for substance use. So here's a list of common illicit drugs. I mean, this list can go on, but I included the ones that I think that are common. So basically prescription drugs, Ritalin, Vicodin, OxyContin, marijuana, ecstasy, methamphetamine, GHB and ketamine, LSD, cocaine, cigarettes, nicotine, heroin, alcohol, PCP, amphetamines, sedatives like benzodiazepines, inhalants, and anabolic steroids. So these are common in adolescent use. So what you want to look for in adolescence is for behavioral symptoms, you want to look at whether a patient has a change in behavior or a recent decline in academic performance when going from an A student to a C student. They start to neglect their physical appearance, look disheveled. They have a sudden change in their peer group. Absenteeism, so the patient is not showing up to school or work, and deteriorating relationships. There's often a lot of conflict with families and friends. And some physical signs you can look for is dilated pupils, bruises in places in the body where there are veins, and you can inject substances like your arms, behind the knees, neck, sniffling nose, bloodshot eyes, and weight loss. So it's really important not to attribute these changes in behavior to puberty. And often parents do that because puberty is a time when children are changing, and they'll have changes in behavior, but you don't want to overlook that they possibly are using substances at this time. So why do adolescents use drugs? So basically, adolescents are biologically wired to seek new experiences, take risks, and create their own identity. Some risk factors include a history of physical and sexual and emotional abuse or other traumas at home. Unfortunately, patients may have a family environment where drugs are prominent and they're experiencing abuse at home, and drugs is a way as an outlet for that. Accessibility is important, whether they have access to it from home or from their friend groups. Mental illness is also a risk factor. Genetic vulnerability is also a risk factor. Maybe a patient had a parent who had a history of substance use, or family members who are excitable and have poor impulse control can be a risk factor for adolescents to use drugs. So also biologically, the prefrontal cortex, which is responsible for assessing situations, controlling emotions and impulses, doesn't fully mature until your mid-20s. And at this age, adolescents are highly motivated to pursue pleasurable rewards and avoid pain. So basically, adolescents have a strong reward system, but can't put on the brakes because their reasoning and they're still developing that prefrontal cortex for control of making decisions and to control their impulses. So I included a few examples that I thought were interesting that are common in adolescence. So cannabis or marijuana, it's derived from the cannabis plant, and 2.5% of the world's population uses cannabis. It's very high in adolescence. Within the last month, 7% of 8th graders, 15% of 10th graders, 21% of 12th graders in the United States have used marijuana. In 2013, the New Mexico rate was 27.8%, which is quite a bit higher than the US rate at 23.4%. And marijuana is accessible in states like Colorado, Alaska, Oregon, and Washington, where it is legalized. To diagnose marijuana use is a clinical diagnosis. The UDS is not as helpful for acute intoxication because the UDS can still be positive after the symptoms resolve. So acute intoxication, some of the symptoms you get are tachycardia, increased blood pressure, increased respiratory rate, conjunctival injection, dry mouth, increased appetite, nystagmus, ataxia, and slurred speech. So basically, adolescents or people who use marijuana are trying to get the intended effects of euphoria, basically a high or that stoned feeling. They have altered perception, increased awareness of sensations, distortions of perception of time and space, relaxation. And withdrawal symptoms you can get is fatigue, yawning, hypersomnia, psychomotor retardation, anxiety, depression, weight loss, anorexia, anger, irritability, and strange dreams. And the withdrawal symptoms are not life-threatening. And the course of the withdrawal symptoms, usually it'll happen in 1 to 2 days of abstinence, and it'll peak in 2 to 6 days and resolves within 7 to 10 days. And often marijuana is overlooked as being addictive, but it can be very addictive. And long term, it can cause cognitive delay or cognitive problems, problems with memory and learning. And it's really important to screen for patients and adolescents because this is when the brain is developing. And they can have long-term cognitive issues with chronic marijuana use. So cocaine is another big one. Basically, the intended effects of cocaine is increased energy, alertness, euphoria, decreased fatigue, need for sleep, decreased appetite, and then you get intense feelings of pleasure. Unintended effects with cocaine, you can get anxiety, irritability, panic attacks, grandiosity, where you can do things that you might not otherwise and can be dangerous to yourself or other people. You get paranoia, suspicious, and you can get psychotic symptoms of delusions and hallucinations, and it impairs your judgment. And then you also can get chest pain, and this is where cocaine can be very dangerous because you get vasoconstriction, increased myocardial oxygen consumption, and you can get a heart attack or MI at a young age because of cocaine. Route of administration. It can be through the IV, smoked, intranasal. Withdrawal symptoms include depression, anxiety, increased appetite, increased sleep, increased dreaming, fatigue and difficulty concentrating, and lack and anhedonia. Physical symptoms aren't as common, but you can get chills, tremors, and musculoskeletal pain. And withdrawal from cocaine is rarely medically serious. Another big one in Albuquerque is methamphetamine. So the route of administration can be oral, intranasal, needle injection, smoking. Symptoms of acute intoxication include hypertension, tachycardia, severe agitation, psychosis, malnourished, and a patient could look malnourished and disheveled. It's a sympathomimetic drug. And withdrawal symptoms include dysphoria, anhedonia, fatigue, insomnia, vivid dreams, increased appetite, and agitation. So alcohol is the most commonly abused substance in adolescence. Intoxication symptoms include slurred speech, disinhibited behaviors, nystagmus, unsteady gait, incoordination, memory impairment, hypotension, and tachycardia. And withdrawal symptoms can include insomnia, tremors, anxiety, diaphoresis, palpitations, headache, GI upset, seizures, hallucinations, and delirium tremens. And alcohol withdrawal can be medically serious, as seen as delirium tremens. You can have seizures, hallucinations, you become hypertensive, tachycardic, you can have hypokalemia, and you're at risk for dysrhythmias, and hypophosphatemia, that puts you at risk for seizures. So alcohol can be a very dangerous substance when used excessively. So conclusion, people are more likely to begin abuse drugs during adolescence and young adulthood, like tobacco, alcohol, prescription drugs, and illicit drugs. And some of the common reasons why kids will use drugs is to, feel better. If they have underlying anxiety or depression, the drugs might be an outlet to help them feel better. They also use it to fit in at school. They might be under peer pressure. Some patients might use drugs as a way to, because they think it'll enhance their performance at school or in sports, because it's a very competitive environment academically and in sports. Kids will use Adderall and Ritalin to improve their academic performance, and anabolic steroids to improve their performance in different sports. So it's very important to screen adolescents at this age, beginning at 11 years old, with the CRAFT screening at every child check, and not to overlook changes in behavior as attributed to puberty, because this is a critical time where the brain is developing, and you want to have an early intervention, because the habits that patients develop at a younger age will continue on through adulthood. And thank you for listening to my presentation. Any questions? And here are my resources.